A lot of people think the way to help anxiety is to make the anxious person feel better as fast as possible. And while that sounds nice, it also accidentally keeps the anxiety alive. With anxiety, especially separation anxiety, relief can become the reward that teaches the brain, yes, that really was dangerous. Good thing that we escaped. That's why exposure CBT is such a big deal. For anxiety disorders in children, cognitive behavioral therapy is a first line treatment. And the exposure part matters because the child gradually learns that distress can rise, peak, and come back down without catastrophe. So let's make this practical. Imagine a single mother with an only child, a 5-year-old girl. I'm calling her a child here because clinically, 5 is not yet adolescence. Even if she already has a very strong opinion and emotional negotiation style of a tiny little attorney. Every time the mother tries to go to work, leave for the gym, or spend time with friends, the daughter becomes intensely distressed. She cries, clings, panics, begs, and maybe even complains of stomach aches at times. And sometimes the mother gives up and stays home. At that point, the family is not just dealing with a hard moment. They're now living inside an anxiety system. And that system is organizing the entire household. Clinically, separation anxiety becomes concerning when it's excessive for the child's developmental stage and causes real impairment in everyday functioning. There's also a second example worth mentioning because this helps people understand the difference between developmentally expected separation distress and something more impairing. Imagining a mother and father with a 1.5-year-old son who starts crying when one parent leaves the room, reaches for them, or wants to follow them out of the room. In a child that young, that reaction is often developmentally normal. Separation anxiety commonly shows up in infancy to toddlerhood and is especially common around the end of the first year and into the second year. So a toddler becoming upset when a parent disappears from view is not automatically a sign of a disorder. What matters clinically is the pattern, the intensity, and the level of impairment. If the toddler is distressed briefly, can be soothed, and still functions within a normal developmental range, that's very different from the 5-year-old example, where the anxiety is so severe that the mother sometimes cannot go to work, the gym, or see friends because the child's panic takes over the household. In the toddler example, parents would usually focus more on calm routines, brief predictable departures, warm reunions, and helping the child tolerate small separations without turning every protest into an emergency. In other words, the principle is still similar, but with a 1.5-year-old, the clinical frame is usually less about treating a likely disorder and more about supporting normal developmental tolerance for separation, unless the presentation becomes unusually intense, persistent, or impairing. Here's the core idea behind exposure CBT in plain language. You don't defeat anxiety by endlessly reassuring it, arguing with it, or rearranging your whole life around it. You defeat it by helping the person face the feared situation in small, manageable, repeated steps while staying in the situation long enough for the brain to learn, I can survive this, and the thing I feared did not happen. That's an exposure hierarchy. It's basically a fear ladder. You start with a small version of the scary thing, not the biggest version, and you work upward, one rung at a time. CBT for separation anxiety commonly includes psychoeducation, work on anxious thinking, and gradual exposure to the feared situations. The biggest mistake people make is going too big, too fast, or too inconsistently. Exposure is not flooding a terrified child and calling it resilience. That's not bravery. That's just chaos with a motivational poster behind it. The point is to pick steps that are uncomfortable but still doable. You want the child anxious enough for new learning to happen, but not so overwhelmed that the entire exercise becomes one long nervous system hostage situation. When treatment works, the child learns mastery through repetition, and the caregiver learns how to stop feeding avoidance by accident. So let's build an exposure hierarchy for this mother here and this daughter. Step 1 might be the mother walking to another room for 30 seconds while the daughter stays with a trusted adult or stays engaged with a calm activity. Step 2 might look like the mother stepping out to the porch for 1 minute. Step 3 could be walking to the mailbox and then returning. Step 4 might be sitting in the car for 2 minutes without driving away. Step 5 could look like driving around the block and then coming right back. Step 6 could be a 5-minute errand real quick. Step 7 could be a 10 to 15-minute errand away, and then maybe 20 minutes. Then a very short gym visit, then a predictable work-related separation. The details can vary, but the structure matters. Small step, repeated until it becomes manageable, then move up a rung. That's the hierarchy. Now, what does the mother actually do during these exposures? First, she gives a calm, brief, predictable goodbye, not a 20-minute emotional TED Talk at the front door. Just something simple like, I'm leaving for 2 minutes, you're safe, and I'll be right back when the timer ends. Then she leaves exactly as planned and returns exactly as promised. That consistency is huge because anxiety hates predictability right up until predictability starts winning. The mother is modeling calm, not panic, guilt, or hesitation. If she looks like she's sneaking off in a sinking ship, the child's brain is going to notice that. Parent education matters here because caregivers often need help learning how to reinforce brave behavior and reduce avoidance rather than unintentionally rewarding it. Second, the child needs coping tools, but they should support exposure rather than replace it. That might include belly breathing, a coping phrase like mom always comes back, a visual timer, a reward chart for brave behavior, or a transitional object. The goal is to not erase all distress before the separation happens. The goal is to help the child stay with the distress long enough to discover they can actually handle it. That's a very different philosophy, right? A lot of families accidentally turn coping skills into escape hatches. Exposure CBT uses them more like training wheels. Helpful, yes, but the child still has to pedal that bike. Third, the mother has to stop letting the child's panic fully dictate the plan whenever possible. I know that sounds harsh, especially with a single mother who is already stretched so thin. But if every major meltdown ends with the mother canceling work, skipping the gym, or abandoning time with the friends, the child's brain gets a very strong lesson. Panic works. It works beautifully. Yeah. It can bring mom right back into the room and shut down the entire adult world. In fact, that's not the child being manipulative in any sense. It's just learning. Brains repeat what gets reinforced, and parents are heavily involved in treatment because home patterns matter so much, maybe some of the most. This is also where everyday people can use exposure CBT outside of a formal diagnosis. The same principle applies to adult avoidance. If you keep putting off the phone call, avoiding the gym, dodging the social events, or refusing to drive on the highway because anxiety spikes there, your life gets smaller and your fear gets louder. The hierarchy approach works here too. You break the feared situation into tiny steps, you repeat each step, and you stay with it long enough for new learning. Anxiety usually wants certainty before action. Exposure teaches the opposite. Action first, certainty later. Sometimes much later. Anxiety is dramatic like that. A few important clinical notes here. If a child's separation anxiety is severe, persistent, causing major impairments tied to trauma, or interfering with school and family functioning, this should be evaluated by a qualified mental health professional, right? Separation anxiety can be developmentally normal in very young children, but when it's intense, lasts beyond what is expected, and disrupts daily life, it may reflect separation anxiety disorder rather than ordinary cleanness. Early intervention matters because unrelated anxiety can become chronic and interfere with development, family functioning, and caregiver productivity. So, if I had to reduce all of this to one sentence, it would be this: exposure CBT helps people get their life back by teaching the brain through repeated lived experiences that discomfort is survivable, and avoidance is not the answer. And in the case of that single mother and her 5-year-old daughter, the treatment target is not simply the child's fear. It's the entire cycle between the child's panic, the mother's understandable rescue response, and the relief that keeps teaching both of them that separation is unsafe. Once that cycle changes, everything starts changing from there.